not many males know they can get a specific cancer called as prostate cancer. You know, as early as 40 to 50 years, every male need to do an annual serum PSA, one simple test to know it is a prostate cancer, and a genetic test called BRCA2. So please get your prostate checked, be aware of this and do cancer screening once a year and don't miss this.
Prostate is a small gland located just below the urinary bladder. Prostate cancer is very common in today's world. In India, 1 out of 8 people are diagnosed with prostate cancer as and when I am speaking about. Prostate cancer, when detected early, can save lives and the treatment is very easy. So, what are the risk factors and how do we know what are the symptoms that causes or that can lead to development of prostate cancer? Risk factors, when we look into it, age, increasing age is one of the important risk factor. Family history is also one of the significant factor. People in the family having BRCA2 mutations. Apart from that, lifestyle factors also contribute to development of prostate cancer. What are the symptoms that you have to watch out for? Prostate cancer usually presents most commonly with urinary symptoms. Increased frequency of micturition, painful micturition, any blood in the urine can be one of the important causes that can trigger or alarm you for noticing symptoms about prostate cancer. Other than that, you can also feel a vague pelvic pain, gradual weight loss. These are the important symptoms that we have to watch out in prostate cancer.
Prostate cancer is one of the commonest cancers in India or any other place in the world for gents, okay? Lung being one of the commonest one, probably the second one would be prostate cancer along with the oral cancers. It usually presents in the older age group, as you know, and usually the symptoms are very similar to the non-cancerous counterpart called benign prostatic hyperplasia. So hence people neglect of it. So the earlier detection would be the better as with any other cancer. This cancer has got an advantage that screening options are available. A simple PSA test, a simple blood test called prostate specific antigen test will let us know whether the patient might be having a prostate cancer or not. Even without symptoms, it can be detected early. Hence at Aster hospitals, we insist, or any other place we would insist, that you please undergo a simple blood test called serum PSA or a visit to a physician, your concerned doctor, so that a physical examination, including a digital rectal examination, might be required to screen out whether you have prostate cancers or not. This can be easily treated and tackled out. The only thing is the symptoms are very commoner compared to the other non-cancerous variants called BPH, and the disease usually spreads earlier or in a slow manner to other organs before we diagnose it in a non-screened patient. Hence the importance of screening.
Now, who needs screening? Basically, any man above 60 years old needs screening, especially who has had first or second degree relatives more than diagnosed as prostate cancer in less than 60-year age, and death due to prostate cancer in first and second degree relatives. Men with family of hereditary cancers like BRCA, Lynch syndromes, and more than 3 family members having breast, colon, prostate, kidney and ovarian cancers will require prostate cancer screening also. Now, what is screening? It involves a simple blood test called prostate specific antigen and a clinical examination by a urologist or a uro-oncologist, which is called a digital rectal examination. Now, once screening establishes the cancer, what are the treatment options? So, we need to risk stratify your cancer once diagnosed to low, intermediate or high risk. Low risk can be observed, and if there are some risk factors in the low risk prostate cancers can be treated actively, or it can be placed on active surveillance and observation. Intermediate and high risk required treatment, it can range from surgical, especially now recently we have robotic radical prostatectomy, which delivers best cancer cures with surgical removal of the prostate and the lymph node, and also preserving functional outcomes like urinary continence and potency. What are the other options? Radiotherapy is an excellent modality to cure the cancer, but it is secondary to surgical because it is not mechanically removing the tumor out of your body. The other options are high intensity focused ultrasound, cryoablations, and also a hormonal therapy which can be used in metastatic stage 4 prostate cancers in case you have been detected with so.
After the initial evaluation and risk stratification strategies, we offer personalized treatment plans for our patients, which is tailored to ensure that the tumor receives the complete dose as well as minimizes the side effects of therapy. Radiation treatments in prostate cancer are broadly classified into two major categories. One is the external beam radiation treatment, wherein techniques such as image-guided radiotherapy, arc-based therapies, and stereotactic radiation treatments are delivered on a linear accelerator machine. And second being the internal radiation of brachytherapy, wherein radiation is delivered right next to the prostate or into it with the help of either permanent seed blaze implants or temporary interstitial implants. Our patients benefit from the advancements in the radiation oncology field, which has been designed to ensure the highest level of care, recovery, and optimum overall outcomes, which is essential for control of prostate cancer.
By targeting the PSMA receptors, that is the prostate specific membrane antigen receptors, which are overexpressed in prostate cancer, PSMA PET allows for the early detection and the metastatic workup of this prostate cancer disease. There is no specific preparation required for this PET CT scan. PSMA theranostics involves the PSMA therapy following the PSMA PET scan. Here it is an advanced therapy which is given for the metastatic prostate cancer patients. It works on the principle of targeting the prostate specific membrane antigen receptor protein. Here we use the targeted radionuclide agents just like lutetium PSMA or actinium PSMA, which specifically binds to the PSA receptors. Thereby targeted binding, they release the radiation which kills the cancer cells specifically and not affecting the normal cells. This PSMA theranostics has found to be highly promising because it extends the overall survival and improves the quality of life of these patients.